All right. Hey, Eric, how are you doing?
Doing well, Jamal. Doing well, doing well. And you?
I'm doing okay. We got a thunderstorm, tornado. The tornado warning just flashed on the screen. So this beautiful backdrop behind me, I wish it were real, but it's
Right.
virtual. It's where I were right now, but I'm not.
Yeah.
But I'm doing okay. I can't complain. Can't
All right.
complain.
Well, good. Well, good.
Do me
My
a
back.
favor. Oh, go
Go ahead.
ahead.
No, I was just going to say we were comparing backdrops. I hope you like my 10-year-old's bedroom here with the lights and butterflies. So just so everyone knows where I'm at.
Yeah, no, it's the reality of this whole working from home total paradigm shift of this coronavirus experience. People are working all kinds of different places, just trying
Yeah.
to get what they got to get done because we got kids stuck at home too. So yeah,
Yep.
I totally get it.
Yep. Yep.
Um, Do me a favor and introduce yourself a little bit. I know your name is Eric Finger, but I want to make sure
Yep.
everybody knows who you are, a little bit about what you do, and particularly where you are, because you're here with me in Austin, Texas, although we are
Hmm.
very much socially distant right
Yeah.
now.
Yeah. Yeah. So yeah, Eric Finger here. Uh, Midwestern kid, came down to Texas for grad school in 2002 and studied physical therapy and came to Austin and a few years later and have been here and been practicing ever since. So about 18 years and started my own practice about 2 years ago, and it was kind of a side hustle at first, and then went full time with it about a year and a half ago. And uh, my practice is it's a mobile practice, and I target busy active professionals who don't want to be traveling to visits and such, and kind of want that one-on-one experience, but in the comforts of their home or at their business and such. And having a lot of fun doing it. I've really enjoyed it. It's what I've always had a passion to start my own business. Didn't know it was going to be this type of model, but it's been a lot of fun. And besides the business, I'm a dad, 3 kids, have a great wife and such, and we're doing the best we can right now. She's in healthcare as well, so, and she's kind of on the, not the front lines, but we'll call it the, just there right after the front lines, treating folks with COVID-19. So it's been interesting. It's been kind of the interesting last 2 months for us and such, but we're doing pretty well.
Yeah, your wife's an infectious disease doc, right?
She is, yep.
Yeah.
And
So
yeah, so she,
are you getting information overload, or is she scratching her head still, or
at the
like
yeah,
this
it's
is the time
interesting.
for her to shine, right? And to be telling you
Exactly.
everything she knows and how smart she is.
Exactly. But and the irony was that she was coming home. She's like, we don't know. We know what we're getting from, internationally, which is, hasn't been a ton. And then they're kind of learning day by day, we have folks touting medications on TV, and then which have shown not to do much. And she's just, they're really waiting on good studies to come out and to show efficacy on treatments and such. So, but they've got a handle on it now. It's been amazing. I mean, there's just in the last month, it's been pretty cool what they've been able to do. She and her partners here in town have done a pretty remarkable job. So,
Yeah.
yeah, it's been pretty cool.
Wow. See, I mean, it's it's always nice, like to, especially when people are getting sick around you, to know you have a doctor in the house. So, right.
It does. At first, it was a little uneasy because we didn't know, where, where we could be, you know, should we be sleeping in the same room? Should we be socially distanced in the house? Can I hug you? And it was a little, that was a little difficult, but we've, we've done more high fives and distant kind of things, distant kind of gestures of love instead of hugging stuff these days. So,
Yeah,
but we're doing all right.
man. Well, one of the three things that I like to talk about, and I usually save these for the end, but I want to tackle them now because it's front of mind. How are you coping?
Hmm.
How you're coping, how are you growing, and how are you caring for what you've learned. Um, how are you coping with all this? I mean, your practice, both in your personal life, you know, you got a wife, right? And most people like to touch their spouses and be around their spouses, and that's why they marry them. You can't do that as much as you probably used to or would like to. And
Mhm.
then, you know, you're a physical therapist. You run a physical therapy business, and physical therapy means you got to touch people too. Like it's physical,
Yeah.
you know,
Yeah.
but
Yeah.
we're supposed
No.
to be physically distancing. So you're
Yeah.
getting it on both ends. Like your career is kind of being restricted in terms of your passion to help people, which involves touching and manipulating them. And then, of course, you know, your passion for your wife, you can't really
Yeah.
touch and
Yeah.
manipulate her the way you want to either. Although I don't know if you would manipulate her, so let me take that back. How are you coping with all that?
Yeah. I mean, yeah, a challenge at first. A lot of, personally, on the home front and such relationship. Yeah, it was difficult and such. But I think one thing we've tried to do, and since we've got a family too, is just try to establish some order and start, getting, the kids waking up at the same time every day, trying to get out and exercising, and we've started taking walks as a family at night and such. And sometimes the kids don't want to go, so we just go and such. So I think there's been some positives, I guess. If there's one positives, we've been out, we're outdoors more. Heck, my 3-year-old learned how to ride a bike over the last 2 months. So, some cool stuff there. So I think that's bonding kind of things for the relationship. With regard to work and my profession, yeah, I had to pivot. And that was to start diving into telehealth, online visits. Um, and I was able to get probably about 50, 60% of my current patients, back in March to buy into that and do that. And that's great. And they've been enjoying it. I mean, they're seeing some benefit from it. So that was a learning experience for me because I really hadn't done that. I'd done maybe a few visits before over the last few months. But really now I was like, I've got to continue this to keep working with these folks. And I think my challenge is to now, how am I going to market that? How am I going to get the word out on that? How am I going to get folks to, number one, utilize that service where they're never really coming in contact with me.
Right.
And as you said, yeah, physical therapy. Yeah, it is literally a hands-on type of medicine. But what's been cool is that, yeah, that part's been taken out. But what folks are, I think, are what I'm trying to sell folks on is my knowledge that hasn't changed. And there's many ways to, lack of a better word, skin a cat, and we can, and if I'm not able to, do it right there, hands on, there's a lot of techniques, and my expertise allows me to do that via, remotely. So a lot of learning in that, kind of learning as we go. But I've been really happy with the results and the feedback I'm getting from my current patients on that. So I think I'm on the right track. It's just now, how do I grow that? Because March and April were okay, financially, but for the business. But I've got to start, growing and getting some more patients and such. So I think that's what my challenge is I'm gonna be working on.
Yeah. So it sounds like you hit the coping and the growing because you're learning how to do skills and use skills that you hadn't used before doing virtual
Yeah.
telehealth and that kind of thing. I've worked with you before as a physical therapist, so I know how intense you could be if you actually could be physically present. I'm sure I mean, me personally, I wouldn't have minded the tele because then you would be able to tell, or can you tell when people aren't doing the exercises correctly? Because I can think of one exercise in particular up against the wall, the one I hated, trying to raise my leg up against the wall when I was having some hip joint problems, and I just
Yeah.
love to be able to fake that one because I hated that one. I absolutely hated doing it. It worked. Just credit, I have far
Right.
less issues than I did when we started working together. But I would have loved to have been able to fake it. I couldn't fake it because you were sitting right there.
That's
So
awesome.
how do you weed that out? Like, can you tell if people are faking the
Oh,
exercises or?
geez. I mean, yeah, I mean, sometimes I can, especially I'm like, hey, let's just do a little pop quiz. Show me how you're doing this. Yeah.
Yeah,
Which one's that? So, I mean,
yeah,
yeah, I mean, uh, it's a challenge, but, I think that's part of my business too. That's part of the challenge of me is getting folks to buy into it. We're not just doing it for your, you know, for your, I should say for your health, you know, we're trying to get you moving. We're trying to reach your
Yeah.
goals here. So
Well, it's the lesson that I think is, like I've learned in the practice of law. Like, tell my clients all the time, I'm like, listen, this is your business. This is, like you can be upset and not want to do it. You can fake it. You can nod your head when I give you advice. At the end of the day, it's your company is gonna, get messed up. Same thing with your patients. Like, at the end of the day, this is your body. Like, you can either fix it and get it working and enjoy it, or you can
right.
end up in a life of pain and limitations and whatever.
Yeah.
So it is sort of accepting and taking personal responsibility for your own life and your own health and your own
Taking
well-being.
action. Yes. Getting my folks to take action, getting that buy-in. Yeah. That's a tough part of the job, but I enjoy it. So, and then in my model, that's the kind of the nice thing too, is that most people who, I'm out of network with insurances and such, it's cash pay. So there's a little skin in the game from patients. And I
Sure.
like that. And I think that typically motivates people to, put their best foot forward when it comes to their therapy and such. So it all works, but yeah, it can be a challenge though.
All right, well, I'm working backwards, so I'm doing the end part first, but let's go ahead and close it out with we did how you're coping, which seems like you're doing that pretty well. How you're growing, clearly you're doing that pretty well. And so all the stuff that you're learning, both at home and at work, what's your plan to carry that forward? Are you gonna use that for just this experience, or are you gonna say, okay, when I am set free again, we are able to
Yeah.
touch each other and work like we used to. Um, are you going to try to move some of this into your regular practice? Are you going to maybe try some telehealth as ways to kind of continue your interaction with your patients, even though you don't have to? How are you going to carry
Yeah.
this forward?
Yeah. Uh, Most definitely. I think I think there's a market for it. I think folks after things do settle down, since we have been forced to, using these types of online or telehealth type of methods, I think folks are going to be interested in them. They've been forced to use it. I think at first people didn't know what it was. How does that work? But now they've got to kind of been forced to utilize it. And I think there's going to be buy-in. I'm still, and that's why I want to really do a little better job of trying to get the word out there and marketing wise and let people know that there is this option there. So option of that, and then two of even having it delivered to them and such.
Yeah.
I'd even say on a personal level, like I'd said at the beginning, getting out and doing stuff with the family in the evening, my kid learning how to ride the bike. Even my older kids are like, man, it was hilarious. It was about a month ago. My 10-year-old's like, man, riding bikes, it's a lot of fun. I'm like, you just learned that? It's just, because they weren't doing that stuff.
Yeah.
They were, in the evenings they were studying, but the tendency is they quickly gravitate to maybe the iPad or something like that. So I think that's good too. It was great to hear that. Great to hear him, saying being outside and exploring and riding the bike is fun and such. So I think what I'm going to learn then is that we got to be doing those things too when it settles down, or carving out some time in our busy evening to try to make that happen. So easier said than done, but I want to do that because I think that's healthy stuff.
Yeah, what you're talking about, especially with the evening walks and the getting outside, it reminds me of the lessons that I still remember and I still try to carry forward and incorporate about just eating dinner together. Like, I
Yeah.
remember I dated a woman maybe a couple of years ago. I don't know, you might have met her or you've certainly heard about her. Who she just really didn't get the whole idea of like eating dinner at the table. It's like, can't we just plop down in front of the TV, or people just grab food, whatever, because I guess that's the way they did things in her
Sure.
house. And I'm like, no,
Sure.
I really want to have that family connection time where we can sit down
Yeah.
and have a meal together. And I take it really, really seriously. So even though technology and, all the quick meals and stuff have come a long ways to where you don't really need to eat at the same time or sit at you don't even need a dining room table in your house anymore. But
Sure.
I still have one, and I think those traditions are important. I wonder if maybe for you, like, the taking the evening walks, something you'd be like, yeah, it's just going to become a tradition of our family. We're just going to, we'll do dinner, however we do dinner, but every night
Yeah.
we're going to go for a walk, or at least, once a week, we're going to go do a walk together as a family.
Yeah. I I totally agree with you. I think that stuff's important. And to back up your point, I mean, there's even research on families that dine together in the evening. They have the kids do better with grades. Social skills are better and such. It's important thing. So, I'm a big proponent in that, and I want to. I've seen the benefit from it, so I'm going to do our best to make it happen when, when we do get back to kind of that normal life we had a few months ago. So, yeah.
So we covered the three things. I'll go backwards again and go back to what would have normally been the beginning. Tell me a little about why what like concierge type physical therapy is, and why you thought this was something important to build a business around, and what's
Sure.
your passion for doing it.
Sure. Yeah. The concierge model to me was going to allow me to, Austin's full of busy professionals. We've got it. And that's what I love about this city. I love the entrepreneurial spirit of this city. We've got some just, great companies who headquarter here, just some really cool, smart folks. And these people are moving, they're doing things, and they want to, number one, they want to feel good. Feeling good makes them perform good. They're high performers, and with minimal time, and their time's valuable. And I thought, what a better way maybe to start a niche of bringing my services to them. So not only that part, but also, being in the clinic for 16 odd years, the way with insurance reimbursement and such, it was getting to be, the corporate model was just really not sitting well with me, and almost kind of making me question whether I wanted to, do what I, do physical therapy any longer. And I'm glad I stuck with it, because there are options for me to still treat folks, but not have to treat 4 people at the same time, and
Right.
pitch them out to, maybe technical staff and such, where, you're not getting that kind of the one-on-one care that I really think, number one, is more, you get quicker results, you're spending less of the folks' time. They're not coming to appointments 3 times a week or twice a week. It's just better for everything. I mean, it's just better all the way around. So it's worked, and I'm enjoying it quite a bit.
So how does it work? You go to people's houses or their offices. You got all your supplies, you got everything you need, and you just show up there and literally put them through the paces like you would if they were in your clinic.
Right. Yeah. I mean, so you're right. I arrive. I've got a portable massage table. It's not that kind of rickety one you might have been on that's made out of wood and such. This is a sturdy table. I've got a rolling duffel with all my tools in there, from massage tools to TheraBands, cords, and such like that. Obviously, I don't have the $30,000 unweighted treadmills or all that fancy stuff, but that's kind of the cool thing about what I've done. My training and such has allowed me to be able to kind of maybe recreate that, or give the patient education on, this is what you need, this is how we're going to do it. Take advantage of, for instance, if you have a gym membership or something like that, hey, when you're there, do A, B, C, and D here. And it's been great. So yeah, arrive with the table, my tools and such, and in and out in 60 minutes, and it works pretty well.
Do you find it difficult to manage, because you're moving a lot, and your patients probably are not? Like, you're always on the go, managing that kind of constant mobile lifestyle. Is that challenging for you?
Yeah, I think it definitely is. I mean, there is downtime, when I'm driving between clients or something like that, I'm not making money. So, there is a certain amount of folks I can see during the day. And I think out of the gates, I was very, flexible with folks, you know, like with cancellations and such, and that can be a real burner for me,
Sure.
just because, you know, I don't have a ton of openings, and I value those pretty closely because there's typically someone who wants a time, and if it's taken, that, you know, someone else misses out, and if you cancel, yeah, that can be quite detrimental. So I've adapted, you know, I've been burned a couple times, but I just learned from it. And that day went home, opened up the file and changed the policies and procedures that day. So to make it, you know, a little, you know, more motivating, I guess, to, you know, you know, give me a call and kind of do the, you know, kind of the expectation I would hope that folks would do. So, yeah, so it can be a little challenging with regard to that mobile part.
Have you connected with other people doing what you're doing, either locally or elsewhere? How are you, you know, where are you getting your kind of inspiration and
Yeah, most definitely.
support on how to make this work?
Yeah, a lot of guidance. I've joined a kind of he's a coach, business coach who's a successful physical therapist out of the UK, but he also does a lot of trainings here in the US. That's opened the door to a big group there. So it's big, kind of a Facebook group that has allowed me to kind of pick the brain of therapists kind of who are cash-based throughout the US here and such, and some have mobile practices as well. So that's been great for bouncing off questions and just hearing about everyone else's. That's the great thing about it, is that someone else somewhere is going through the same thing you are. And it's that, number one, that feels good, because I think a lot of times as an entrepreneur, it's kind of lonely. You feel like you're the only one doing it. Everyone else is succeeding, and, you know,
Yeah.
and I quickly have to put those thoughts out of my mind, because that you know, but so I think the best part about that has been getting with groups, and then also just you know, reaching out to, you know, professionals, health and wellness professionals here in Austin has proved beneficial for me. So just starting relationships with them, letting them know I'm out there, how can I help you, has been pretty cool, and has opened up some opportunities as well. So just trying to meet as many folks as I can, and just start some just kind of organic relationships with them. So you know, at the beginning, it was kind of funny. I was always thinking, okay, I'll go meet this person and I'll ask them for something immediately. And quickly I found out it's not the best way to start a relationship.
Sure.
So
Yeah.
Learned a ton.
Yeah, peer relationships and all those things, they take time. Like any other relationship, you got to invest the
Mm-hmm.
time, and you kind of get what you give. You know, you
Yep.
garbage in, garbage out. But that's one of the things I like doing now, is helping people build better peer relationships and getting all the advice that they can from people who actually have been there, done that, and or maybe going through it right there at the same time. But you know, having two people tackling a problem is usually better than having one.
Right.
So I'm glad you're doing that.
Yeah. It's worked out well, and I've enjoyed it too. It's been enjoyable, and I like sending. It's been good to have a network too. As you grow this network, you can start pushing. You know, my clients have, you know, questions on nutrition, and I try to stay in my lane, and then find network and kind of surround myself by professionals who I respect, so I can pitch or direct them to folks. My patients really appreciate that. So.
Yeah.
Yeah, so that's been good.
So before we wrap up, tell me one, you know, is there one little piece of advice or tidbit you could give people on things they could do to kind of take better care of their physical bodies?
Yeah, I'd say, you know, daily, get out, you know, give yourself 15 minutes to change your environment. If you've been inside all day working or something like that, get outside, get a fresh breath of air. I don't even just sit outside. If you're not in the mood to take a walk and get your heart rate up, you know, just a change of environment, get a little sun. I think that's key. It's really good. Yeah.
That's great advice. All right, so as we wrap it up, how do people find you and your company?
Yeah, well, obviously we're online. We've got a great website. We're on Instagram and Facebook as well at Move Empower. concierge physical therapy, and moveempowerpt.com, and got a lot of great stuff on there. A lot of interactive. Got a lot of free PDFs and such for folks who are curious about, musculoskeletal issues they have and such. And we love to do free consultations. We always start off that way. There's no pressure sales or anything like that. Number one, I like to kind of vet my patients and let my patients vet me and find out if we're the right match and such before any appointments set up. So we offer that as well.
All right. Well, I mean, I hope folks will check you out, because I know from experience that you're pretty good at what you do. Because one thing I know from experience, people that like to work out a lot, if you're active, if you're athletic, you go to the gym, you lift weights, you're probably going to injure something at some point or another, especially if you're over a certain age, because, it's just the nature of the beast. And
Right.
if you're not doing anything about it, it just gets worse and worse and worse. I remember, I think it was my shoulder.
Yeah.
And it had been bothering me for a while. And then finally, it just got so bad, it just froze up, and it was, it took months before it ever released again. And I probably could have prevented that had I done something about it sooner. But I was like, it's just a sore shoulder. I mean, I do pull-ups or, whatever. It's just sore. It'll be fine. And, So if you're sitting there thinking, oh my God, it's just sore, I just, it'll be fine. It probably won't,
Yeah.
Go talk to somebody about it. But man, it was great to see you, Eric. It was great to connect. I look forward to seeing you in person, hopefully sometime soon. And I hope everything's going really well with your business and, your family, more importantly.
Thanks, man. Yeah, I appreciate it. Appreciate the opportunity.
All right. Well, I will see you again, hopefully real soon. Have a great day. Stay dry, because I know there's forecast for a lot of rain and storms for a while here in Austin, and be well.
All right, man. Thanks. Take care.